Sometimes more than the patient, the partner is happy because something they haven't told, something they were suffering from, and suddenly it gets better. And then having a lot of fights at home. He was even afraid to think of trying with someone else because of him feeling that he won't be able to perform and all. On the other hand, if there is anger hidden inside, that person can never open up because within, I think, 7 to 10 days, he just came back. I had given him a follow after a month. After 10 days, he came back and everything is fine. Doctor, I am completely fine.
Hi, welcome back. This is The Mind Reimagined. My name is Ellen Chamberlain. This is a podcast about mental health, and today we will talk about an area of life that does affect our mental health, and that is sexual intimacy at home. Our guest is Dr. Mourya. Dr. Mourya is a highly skilled psychiatrist and sexologist with 4 years of experience, and he practices at Maarga Mind Care. He holds an MBBS and an MD in psychiatry, with specialized expertise in both psychiatric care and sexology. Beyond his work as a sexologist, Dr. Mourya's expertise extends to treating a wide range of mental health disorders with a specific focus on non-invasive brain stimulation techniques. He believes in a holistic approach, focusing on a comprehensive understanding of each patient's specific needs. He is dedicated to providing sensitive and confidential care, helping individuals and couples address issues such as erectile dysfunction, low sex drive, and other psychosexual concerns. He tells me he is committed to community-focused mental health care and working to reduce stigma, promoting mental well-being for all. As a sexologist, your field addresses sensitive and often misunderstood issues. To begin, can you help us understand the most common challenges you see in your practice?
Sexual medicine, it's a stream which is has to deal with talking to patients daily, understanding their intimate concerns, their problems with they face in the bedroom. So often the conversation is not so easy to start with. Patients hesitate a lot. They anticipate what the conversation is going to be before coming. Sometimes they delay the consultation because they're worried what will be the conversation. But eventually, once they're in the consultation and they discuss that, we can figure out what's happening and what is to be done, what are the challenges they are facing on a daily basis. In my clinic, usually I see patients suffering from erectile dysfunction, premature ejaculation, pain during sex. At times, they are having problems with desire. There can be a discrepancy of desire between partners, which can cause a lot of problems. Challenges, if you specifically ask me, often the challenges are more in terms of relationship issues or some unresolved conflict where it requires a lot of exploration to figure out what exactly is causing the problem that they're facing now or presenting with now. But once that is figured out, therapy can help in certain situations, medications can help in certain situations. Also, some changes in daily routine or some changes in their behaviors or their reactions towards certain situations at home or even outside home, when they are with their partner, that can make a lot of a difference. If those changes are done in a systematic manner after discussing with a professional, understanding what can help both of the person grow more emotionally together and to understand what the other person needs. Challenges apart from this, often it's like if the situation has gone too far beyond, if it has been more than few years and things have been chronic, there can be a lot of arguments, fights and all, which can add on to whatever problems initially were there. So that requires a lot of unwinding and going back to what has happened and then rebuilding the relationship to an extent.
It can compound the issues to put off talking about it. Can you think of a story, obviously, patient confidentiality, but I'm curious if you have walked away from patient relationships having really seen success, that all you needed to do was just tweak it a little bit for that couple.
Right. Um, I had this couple, I think, few months back coming to my clinic, where there were a lot of unrealistic expectation, I should say. These unrealistic expectations are usually set by the source of knowledge. It depends on the source of knowledge. Sometimes it will be something random, some explicit material they see on web or somewhere, and or something they read, some blog, or some friends sometimes discuss
And exaggerate.
Yes. So while discussing, they would exaggerate. They would say something which these people will take seriously, and then they would discuss why it's so different when we are trying compared to what others are trying. So that got them really worked up that something is wrong with us. Maybe so the primary concern here was about the duration of the intercourse, where the friend or some people had informed them that it should be somewhere 30 to 45 minutes, which to them was like, how is that even possible? Like it's not even reaching 5 minutes. How is it going to go that long? So there I needed to explain to them in details about what are the scientific studies say that is 2 to 5 minutes is normal, and anything beyond that, it also depends on the mood on that particular day. How the people are planning the intimacy itself can have a huge impact, like that. Sometimes the duration can go longer than 5 minutes, but they shouldn't be hoping for that all the time. Then there will be only disappointments. So after they understood it, they were still not so sure whether they were feeling better. But then when they went back and came back after around 2-3 weeks, they were saying they felt much better, because now they started feeling that this is normal and this is good, and they started enjoying it.
It can really just be that easy. Just go and ask the person that knows, which is the doctor. Absolutely.
So I'd also like to tell about another case, again confidentially. I'll not go into any too much of details, but there was this man who came, who was struggling for around 2-3 years, not having good erections, and then having a lot of fights at home. He was even afraid to think of trying with someone else because of him feeling that he won't be able to perform and all. And at the end of the day, he was scared of using the over-the-counter medicines which his friends suggested him. And he had hypertension, and he also had some kidney related issues, so he was scared of using medicines. He tried to limit his medicines. At when he visited me and I gave him the medicines, he was asking a lot about side effects and all. But then I explained to him that usually it's very minimal when we use it for a short duration. And I remember this case basically because within, I think, 7 to 10 days, he just came back. I had given him a follow after a month. After 10 days, he came back and everything is fine, doctor. I am completely fine after 2 years. I don't know how it happened, but now tell me how to reduce and stop the medicine. So I helped him with that. So it was very fast and very interesting. And also, in many cases, I see one more thing is that sometimes more than the patient, the partner is happy because something they haven't told, something they are suffering from, and suddenly it gets better out of their expectation. So it usually makes the person very happy.
Yeah. It's so much about reframing it, isn't it? And that comes with the conversation, the awkward conversation. So it's really great that there are doctors that care about this area of life and health, because it is a health and quality of life issue, and mental health and emotional health. And it's really good to know. I think it's good for people to know that this is available. So I really appreciate your time. Let's discuss low desire, which is a common concern. What are some of the key factors, both physical and psychological, that can contribute to a decrease in a person's sex drive?
There are multiple factors which may contribute. Primarily speaking, we can differentiate the factors into two categories. One is the biological category, where we talk about the aging, then the hormonal changes a person might go through, life circumstances, major events, those may play a major role. Apart from that, there is a psychological aspect where depression, anxiety, or any other psychological issues, even relationship issues, lack of understanding, those can contribute to feeling of being less connected to the other partner, feeling distant, emotionally unattached. That can have a impact on the desire aspect. Also, I see often men specifically coming up saying they are having difficulties with desire when they are also having some other problem, let's say erectile dysfunction or premature ejaculation. So often what I have seen during my practice is for men, they associate their libido or their interest greatly to the quality of erection they get. And for women, it's more about the trust and the understanding in the relationship. The more that is there, that the more they feel connected and the more they are interested. There are also cultural factors at times playing a role. Certain people have belief that they should live their life as a celibate, or they should avoid sexual intercourse apart from going for any pregnancy or childbirth. So those beliefs will be there in certain people or in certain communities, where that has to be kept in mind while resolving their issues. Also, for people who, due to these cultural issues, who don't think lack of desire to be a problem, they rarely reach out. That is also a challenge that is there in the community.
Dr. Mourya, many couples face a discrepancy in sexual desire. One has more than the other, there's an imbalance. How can you know what the difference is and begin to navigate the issue?
After marriage, this discussion should always take place with regards to what each of the partners want. Even before marriage, let's say in any relationship, whenever two people are getting together, they're thinking about how to be more comfortable in the relationship, how to get what they want out of that relationship. There should be a clear and open discussion about what is their expectation out of it, including the sexual aspect of it. Often, due to many reasons, sometimes cultural, sometimes personal, sometimes the relationship, the way it built up with time, or the circumstances the people are in, can lead to a situation where they don't discuss it up ahead, or they avoid the discussion, fearing something will come up which might trigger something or something like that. But at the end of the day, whenever discrepancy is there, the best approach is to discuss, for both the partners to sit together and discuss what is it exactly, how much it is impacting each of their lives, and how they can deal with it. Whether they can plan in a manner where they can try to help the other person in whatever way. Let's say the partner with lower desire may agree to have some higher than their usual frequency of sexual intercourse or intimacy or anything, while the higher desire partner may choose to negotiate and decrease their demand part, where they can reach an understanding in between. The rest of it they can manage and discuss, and according to the situation, according to their life, they can make a plan as to how they want to deal with it. Sometimes it may be difficult for the couple to just sit among themselves and discuss. As I said, many factors may play a role in that. But if they are unable, professionals should be able to help them if they reach out. Specifically speaking, psychotherapists who deal with sexual illness and the problems around that, they can easily help a couple deal with discrepancy in desire within a few sessions, 3-4 sessions. They can reach a middle ground, make a plan in for future how they should deal with it and all.
Sexual health, wellness, pleasure, intimacy, like every conversation in every area of our life, it's so difficult and frightening, as you say, because we may be putting something on the line. We could be rejected and lose what we were hoping for. But if we don't talk about it, that's the double-edged sword, right? If we don't talk about it, then maybe we won't be able to achieve it, and then later things break down. So are you saying that premarital, a couple maybe could seek out a therapist who could act as a mediator to help them have that conversation?
I would suggest that premarital couples should at least have a clear and open discussion about their expectations in that relationship. And that discussion should include all aspects: financial aspect, the
Absolutely.
future, the personal aspect, as well as the sexual aspect.
Child raising.
Child raising, parenting. So all of this should be part of it. If any of these aspects are missed out during the discussion, invariably conflict will arise.
Surprise. Yeah.
So the sexual part is often ignored by partners, thinking that how the other partner will perceive that before marriage itself we want to discuss about it, given the community in different situations. Often in arranged marriages, other family members will be around when they initially meet and discuss things. So privacy is also needed for these discussions. So plus confidence also matters. Some person may feel very uncomfortable discussing about it when they are unsure about what they want, or they are unsure about what their own expectation is out of that relationship. That can be a factor. In that case, professional help would be more important compared to just having discussion.
Yeah. That's true. If you have no frame of reference, how do you know what you would like? It's an important point. Two of the most frequently talked about male sexual disorders are erectile dysfunction, ED, and premature ejaculation, PE. Can you briefly explain what these conditions are and the various factors that might cause them?
So erectile dysfunction basically is a problem where a man is unable to get proper erections, or even if he gets an erection, he loses it fast enough so that no meaningful intercourse is possible. Now, the problem usually can be primarily twofold. One part is about the mental health aspect. Anxiety, sadness, those can play a role. Any conflict with a co-worker or the partner itself, that can have an impact on a certain day. But when a person is having frequently again and again similar problems, they should seek help from a professional. Otherwise, once or twice here and there, that is normal for anyone. And the other part is premature ejaculation, as you are saying, as another more common illness among the men, specifically if we speak. Premature ejaculation is to deal with a situation where basically the person is ejaculating faster than they intend to. Now, it can be perceived by either of the individual involved in the intimacy act, because often one person may feel this is enough while the other person feels this is not enough. And at the end of the day, the scientific studies have given us some definitions where we say if it is less than 2 minutes, somewhere around 1 to 2 minutes after the intercourse is started, then that is premature ejaculation. Over and beyond that, it's about a discussion between the partner and their understanding. Now, if you want to ask me about what are the factors contributing, so there are again biological factors and psychological factors. Biological factors would include aging, hormonal changes, life circumstances. Trauma can have an impact. Negative past experiences can have a huge impact. While psychological factors would include any pre-existing psychiatric condition, any major change in life, any death in the family, any major event, life event. Those could have a trigger. And even apart from that, sedentary lifestyle, or like nowadays in the metro cities, people going only for desk job and then spending rest of the time with recreation, that has, I think, impacted a lot, in sense that it has increased the number of people suffering a lot. And simple physical exercise regularly and maintaining the emotional health.
Why is that always the answer?
Can definitely help. That's it.
And medication can be a factor for men or women in these issues. Is that correct? Sometimes medications we really need.
So medications, there are specific medications, specifically some of the antidepressant medications and some of the antihypertensive medications can contribute to low desire, and not specifically just low desire. It can be lack of blood flow, lack of good erections as well. Many things can happen. But see, when giving the medication, that doctor who is seeing the person and giving the medication, they usually give it based on risk benefit analysis. So they perceive that the benefits are more. But if the patient is getting distressed by that problem of that medicine that is causing, so then they should reach out, have a discussion, or if that doctor is unable to help that person, they should be able to find help from a different professional who could be dealing with these sexual health related concerns, and it can make collaboration between both the doctors in terms of choice of medication, dose of medication, timing when they take it. Those can have an impact in terms of the
Adjustments.
performance.
But that's another conversation that's required. If you start the medication, it's prescribed to you, and if you don't connect the dots that it's giving you a problem in the bedroom, or you're unwilling to go tell the doctor, hey, I think I'm having this side effect, again, you don't have a conversation and then you miss the boat.
Sometimes people may think that because I am ill, I am having this, let's wait for some time. But the waiting should not go too long. Anything beyond 6 months means it's chronic. So if it's less than 6 months, they can still want to wait and watch and see what happens, discuss and decide. But after it has been happening regularly for more than a period of 6 months, I think it's better to go for a professional help.
And this would be if you're experiencing the condition or if you're possibly experiencing a side effect. Wait a couple months, especially on a new medication, right? It takes some time.
So basically, even depression, anxiety itself, when it's untreated or when it's partially treated, itself might be leading to reduced libido, reduced sexual performance as well. So it's not just always about medicine. Both illnesses, medicines, both can be contributing. But only with the discussion, someone can find out what's the factor. We call that as root cause analysis. When we are seeing there is partial response to medicines, or when we are seeing that person has improved and then suddenly deteriorated for unknown reasons, which is difficult to explain while on treatment, then we would need to do a cause analysis and find out why is this happening. There would be some other factors contributing.
Beyond the physical aspect, what is the psychological toll that these issues can have on a person's confidence and self-esteem?
In the society for men, the sexual performance, at least I'm talking about the Indian context mostly here because I see patients here. So in the society for men, what I have seen is a lot of value is put into being able to perform, being able to satisfy another person. So when they themselves first realize that they are unable to do that for whatever reasons, once or twice also might trigger some individuals, or more when someone faces it more repeatedly, regularly over a period of time, definitely it is going to impact their mental health to a great extent. Basically what happens, they will feel inferior, they'll feel sad, they might feel frustrated, they might have questions, why me, why at this age, what's happening, what is the reason, is it permanent, is it aging? They might have a lot of thoughts about it. There are a lot of myths and misconceptions also. Often there is not a good enough source to refer to when they want more information regarding understanding what's happening. And the sources that they reach out, if it is some friends or some random online source, that can give them some information which will confuse them more, I'd say. So at the end of the day, confused person will feel more frustrated, angry, sad, all of these things. And if there is criticism from the partner, or if there is a lack of, let's say, when the problem starts, initially, usually it's noticed by another partners. After it is noticed, it is normal to take some step regarding it. If none of the partners take any step regarding it, and if they start thinking it is normal and let us move on with how it is, then over a period of time, someone may feel frustrated or angry even though they might not be at fault. That why are we letting this continue while the other person wants to continue like that. So lot of things may happen, different scenarios, different things may happen, but it has a huge impact on the personal confidence. Even when the problem persists for like 3-4 months, 6 months, what I see is the lack of confidence and this other psychological issues spills over to the other areas of life as well. The relationship, the profession, their own hobbies and day-to-day activities, that can get impacted if it is getting too bad. And then if it reaches that severity, psychiatric help will also be important. Maybe just sexology consultation may not be enough for them.
Because by then, with procrastination and you're losing interest in the other things that you enjoy, it could becomes a situational depression, we might call it.
Yes.
Yeah.
Could become some anxiety disorder or depressive disorder. which is triggered by that conflict.
So we care about men, we love men. How about women? How do these various circumstances affect the self-esteem and confidence of a woman?
So for women, uh, in the context of Indian situations, what I'd say is most often prior to marriage in relationships and all. See, now there are two divisions to these relationships. In metro cities and all, I see a lot of balanced relationships, I'd like to call them, where there is clear understanding about what each partner wants, and there is more discussion where they find out the problem earlier. One of the partners at least pushes the other partner when one partner is hesitant to seek help and all. But there are these other kind of relationships also, maybe slightly previous generation or people who are not living in metro cities, where the environment is slightly more conservative, more like older times and all. So there, it's like the decision has to be taken by the main person in the family, or the person who is earning. So then the decision making can get delayed a lot. And when the couple is suffering, irrespective of whether the problem is with the male partner or with the female partner, when the couple is suffering because of any kind of sexual health problem, where the sexual health, sexual intimacy frequency is going down, or uh, there is not enough satisfaction from the activity, the woman can similarly start getting frustrated, irritated. It can spill over to other areas of her life as well, like taking care of the child, or her own job, or her own daily activities, her interactions with the other family members, her own family members, in-laws, everyone. That can take an impact. Often, one thing that interestingly complicates the situation a lot, this I don't think will happen in Western scenarios, it is that the family members get to know it when they're trying for a child, and that there is no intercourse at all. One of the partner will inform family, and that will lead to further complications. They will try to push from their own side.
Which is not
Not
advised.
helpful for anyone.
Thank you. Let's finish that sentence. How about the connection between relationships and sexual health? We often think of sexual issues as purely physical, but how do a couple's relationship dynamics, things like poor communication, unresolved conflicts, or a lack of emotional intimacy, how does that directly impact sexual health?
Right. So, there is a gender difference in this aspect, specifically, if I say. For men, the experience of the sexual aspect of the relationship has often to do with whether they are feeling interested or not, and then once interest is there, whether there is satisfaction or not. That part is usually mostly enough for men, as long as there is no conflict and all around it. But for women, apart from these two factors, trust and the safety and the emotional attachment also matters a lot directly to their satisfaction from the intercourse or
And
the
interest.
intimacy. Yes, interest as well. So when there is an unresolved conflict, or when there is a fight that pushed under the rug, we'll see later, we don't have enough time or something like that, that can later come up during when in the bedroom they are thinking of intimacy. They can feel emotionally distant. They can feel that there are some discussions that are impossible in this situation before we resolve the other issues which are longer standing and all. On the other hand, if there is anger hidden inside, that person can never open up. And any kind of intimacy requires the person to feel relaxed and to be ready to get into situation where they might be having lack of control over the situation. So losing that control requires you to trust a person and have a good rapport with that person, and things like that. So there, this conflicts, emotional distance, or lack of discussions itself, additionally along with these misconceptions, can also be there. which never discussed. No one knows, only that person knows in their head. So we don't know what would be the factor, but at the end of the day, both will suffer for sure.
Conversely, when a couple addresses their sexual health, how can that positively influence the overall health of their relationship?
So sexual aspect of the relationship is definitely one of the major aspects, as we understand through scientific studies over the years, that sex is just like a basic need, like home, like food, like the shelter, everything. So when it comes to the relationship, when we discuss about this aspect, somehow because of whatever reasons, it's people try to give less importance to it, or like push it aside, we'll see later, will probably be incompatible, things like that. But when the problem persists for a period, as we were discussing just a few minutes back, that leads to conflict, that leads to irritation, frustration, could even lead to mental illnesses, even relationship disputes, problems with the child can happen because the parents are fighting all the time. So many things are possible because of that. Now when any partner, I'd say, like any of the individuals involved in the relationship, once they reach out to seek help from someone, usually as long as both the partners are committed to that relationship, the other partner will support it. Sometimes what will happen is the boat has sailed too far, that relationship is not in a stage where they can really get back into intimacy. Probably they need to fix the relationship first, then maybe even seeking help may not immediately lead to a lot of improvement or anything. But until that has happened, in any kind of just where the problem is starting, few months there, if they seek help, it is supported by the other partner, they feel more connected, they feel more understood, they feel more cared for by each other. So usually it leads to improvement in the overall relationship as well.
When is it time for a person or a couple to seek professional help from a sexologist for these issues? What should they expect from the first consultation?
I think during our earlier discussions, once I mentioned it, that people do procrastinate a lot. At least that's what I see here. People sometimes even come and tell me that I have been procrastinating since last 2 months, 3 months, or a year. I've been thinking again and again. Once I even booked and then didn't visit because I was afraid what would happen when I come. So the expectation, I think, is not clear in most occasions in their mind. That clarity needs to be there. They are unsure what words to use. They are unsure what kind of details do I need to divulge, because this is not something they can discuss with everyone. Mostly they can't discuss almost with anyone except some friends, maybe very close family members, which not everyone will have. So many people are there who will just have it to themselves till they come and meet a professional. So for them to articulate the problem in their mind and to tell it, even the history, what has happened so far, for many people it's very difficult. So when I am talking about what they should expect, I'll try to give a clear picture as to what exactly happens. What happens is the person would come in. Initially, I want to know about some of their basic details, maybe age, height, all of these things, which is for any consultation. After that, I would let that person himself or herself describe what they're going through. So once they start describing, we can catch what's happening from that discussion, and then go into more details about what has happened in the past, or what their expectation is, or what their partners are saying. And then eventually, as the conversation goes along, there is a more clearer picture that comes up with respect to what's happening. Sometimes based on the conversation and the diagnosis, there may be need for some blood investigations, there may be need for starting medications or therapy depending on the situation, or multiple of these, like more than one of these together may also be used in certain situations. But usually the conversation is very respectful, very direct, very clear cut, and there is most often after discussion a clear way of getting out of the situation comes up, with where both the patient and the doctor agrees. So that is the major point of starting. So from there we can start the journey, and as the patient keeps coming back, we can understand more, help the person more, and move towards improving the whole situation. One more thing I'd like to say is, specifically in Indian context, women have a lot of hesitancy, especially for reaching male doctors, I'd say. Even female doctors also, I'd say that many women, they feel that if I reach out for solution of this problem, that means I'm thinking about this a lot, or I'm considering this as a very important factor. So at the end of the day, all studies tell us this is a very important factor. There is no denying it, even though if in public spaces people don't want to talk about it. So that is something that I think the newer generation is realizing. Newer generation is starting to come out for help when they need it. But I think having a consultation can really change a person's expectations out of it.
That's what I was going to ask you. Do you find that once someone comes to a consultation and they get over that first 15 minutes of awkwardness with the doctor, do you find that when they come back throughout time that they are very comfortable when they walk in the room and it has become a normalized conversation for them?
Most often it happens that way. Some reservations are there in certain individuals, obviously, that we have to keep in mind while talking to them. But otherwise, most often they get more and more comfortable. It's usually not even 15 minutes, it's like 5-7 minutes. It's the first few, deep breaths, first few drinking some water or doing something. And
Talking
then once
about the weather.
Yes, something like that. Sometimes people will use analogies to discuss about this topic because they are so afraid of the word choices and these things. So they will use a cricket analogy, they will use some dinner analogy, some food intake, something like that.
And then do you sort of give a guidance and repeat back to them what you heard in medical terms, in plain language, to signal them that that's okay?
In normal language, I try to talk to them, and when they are having difficulty finding certain words, whatever word they use, I try to give them the specific term for it, which can be more neutral. And then at the end of the day, during the discussion, I always try to tell them clearly the diagnosis, at least in technical term, so that they know it. At least for later consultations, they can tell it to some other doctor that what was happening. Other than that, the discussion is totally in like normal language, because technical terms are for us, not for
right.
clients.
But it's good for people to get comfortable, as you say, with talking about bodies and intimacy. Well, I think that we've covered what we're going to cover today. We are looking forward to another interview with you about a completely different subject, but this was very enjoyable and I really appreciate your time. Thanks for coming.
Thank you, Ellen, so much for having me.
Okay, talk to you again.
Looking forward to meeting you again.
Thanks. This was a very enlightening interview. I enjoyed it. I hope that you did too. This is The Mind Reimagined. I am Ellen Chamberlain. Thanks for stopping by. You've been listening to The Mind Reimagined, Paths to Wellness. Continue to tune in and heal within. See you on the path.